Hi, this is Robin Finney. This is my video on my philosophy of therapy. I had a patient come in and ask me, what is your philosophy of therapy and what kind of therapy do you provide? And this is the answer that I would at this point give to that patient. So first of all, if we were going to have psychotherapy together and psychopharmacology together, the first and most important thing we would do is to develop an effective therapeutic relationship. And what I mean by this is that throughout the therapy sessions, the goal will be to develop mutual trust and respect so that you feel comfortable sharing your physical, emotional, and spiritual needs, and then also your concerns, past experiences, future goals, without any fear of being judged by me or anyone else, and with the feeling that you're safe. In fact, that's the most important aspect of a therapeutic relationship, is the feeling that you are safe. In addition, we would develop a set of long-term and short-term goals based on your symptoms and the discoveries that we make during our conversations in therapy. In other words, we will talk together about your current symptoms, work through your thoughts, your insights, and behaviors with the aim of discovering what led to those beliefs and thought patterns and how to develop new patterns and beliefs in order to reach your long and short-term goals. And we would do this in collaboration with each other. It wouldn't be my goals, it would be our goals that we set together for you. Throughout this experience, you'll also work on interventions or homework. And that homework would be based on progress towards goals that we've already made. And then we would review the homework at each appointment, and we would adjust it accordingly. If you needed more help in one area, we would do more intervention in that area. If you felt like you were able to move on from that area, then we would be moving on. We'll review these at each appointment and add or subtract from our goals as they're met and develop new goals until you've reached the state of functional independence or improvement that is satisfactory to you. The benefits of seeing me for both psychotherapy and psychopharmacology, there's a couple. And one of them, and the most important one, is that the integration of these services works to provide kind of a holistic approach for your psychiatric care. So as we work through the symptoms and the foundation of those symptoms, I'm provided with improved insight into your experiences, and I'm able to prescribe accordingly if it will ultimately lead to improved outcomes for you. Integrating the services does provide that holistic approach that I talked about, and I'm able to enhance the progress made in therapy with the most effective psychopharmacology. Utilizing one provider for both services is also cost effective. You're essentially billing the insurance one time for both services. So that's always going to cost less. And then, of course, it's efficient because you only have one appointment rather than two appointments with two separate providers. You have one appointment with one provider who provides both the medication management and the therapy. So that saves you time and money. There are always challenges when you are in therapy with anyone, not just somebody who provides dual roles. But there's always a chance that in therapy you'll experience something called transference with me. And what that means is that in the discussions we have, you may develop these feelings towards me that may not be pleasant. They may be negative. And it's based on your past experiences and something in me that might remind you of a situation or a person in your past that caused some sort of trauma in your life or negative feelings. I'm trained to recognize this and how to help you respond to it appropriately. but you are still in charge of your response and your emotions associated with that. So occasionally, and it's never the hope or the goal, but occasionally if that occurs, it might cause problems in the therapeutic relationship that interrupt our ability to be successful. And in that case, you might want to seek out a new provider, and that would be okay with me. It's completely understandable. So we just need to keep that open line of communication so that if that does occur, I can help you find somebody who would meet your needs in a more appropriate way. When it comes to my philosophy and the type of therapy I use, my philosophy of therapy is as much as possible to allow you the opportunity to explore your thoughts, emotions, experiences, and behaviors in order to reach personal and lifelong goals for yourself. My role is simply to be a facilitator. I'm not going to lead you, I'm going to facilitate the experience. So in order to do that, I will follow your lead and ask you questions that hopefully help you to think through and discover why you think the way you do, where your beliefs come from, and how your experiences impact you today. And then also what you can do to enhance your behaviors in order to reach your personal goals. This is something everybody needs to go through or should go through. And basically it's asking questions like, why do I think the way I do? And if it's not positive thinking, if it's not positively impacting my life, how can I change that thinking so that I can have a more positive outlook on life? Sometimes the process is quick and simple, and sometimes it could take years. It will likely involve many emotions, including tears, anger, fear, laughter, and awe, or any other emotion you can imagine. We will try to set many short-term goals and a few long-term goals so that you're less likely to become overwhelmed with the process. Some goals we might set are things like recognizing, accepting, and coping with feelings of depression, developing healthy thinking patterns and beliefs about yourself and about the world that lead to less symptoms and help to prevent the return of those symptoms, to resolve depressed mood and return to your former level of functioning before you became depressed. There was a point where you were not depressed. We just have to get back to that. We might include a personal inventory that reaches into your past relationships and any depressive ideas related to those relationships. We may discuss unresolved grief. We may talk about problem solving in relationships and the role and importance of healthy boundaries in relationships. And those can be relationships with friends, family, bosses, neighbors, anything. We may even talk about exercise and nutrition and its role in lessening depression or depressive symptoms. Other things we might do in therapy is investigate your thinking processes, your behaviors, your past experiences, your present circumstances, and your future goals. During this time, it will be most important to me that you feel safe. Again, safety is really important in order for you to fully express yourself without fear of judgment, and with the knowledge that everything you say or experience is kept in full confidence according to the contract you would sign with me before we started this journey. In order to do this, we might look at current and past experiences with depression and the things that you did on your own to try to resolve the depression and whether they were effective or ineffective methods. We may try to identify the foundation of your depression or the source of your depression and talk about psychopharmacology as a possible addition for you in treating problems associated with depression, such as sleeping, attention, focus, appetite, rest, or anxiety. We'll openly discuss any thoughts you might have of self-harm or of harm to others, and we'll work to identify and replace thinking patterns that support these thoughts. Finally, I consider this a partnership, a collaboration, an opportunity to develop and work towards reaching shared goals that ultimately lead you to live a fulfilled and productive life. I hope that answers all your questions. If not, please let me know and we can discuss it further. Thanks so much for your time.